Thank you so much. So I think I will start. So thank you so much for your brief introduction and also for inviting us to tell you about patient innovation and how, in fact, we created a platform that in about 3 years is now considered a very large portfolio of medical technology. In fact, we have about 700 medical innovations coming from all over the world, coming from over 60 countries. And this is just counting the ones that were already medically screened. And, you know, I could mention a bunch of our awards, but probably two of the most significant ones were the fact that we were named Nonprofit Startup of the Year in 2016, as well as we were recognized by Mr. Ban Ki-moon. And what are we talking about? I mean, we are talking about innovations that were developed by patients. Let me give you some examples. Let me tell you about Mr. Tailgoldsworthy that you see here in the picture. In 2002, he went to see his doctor in England. His doctor told him, look, I have bad news. I'm afraid you are going to die. And this is because your aorta is not strong enough for the flow of blood that goes through it. Of course, he was not happy with the news. He went home really upset and thinking that probably he could fix the problem. And at home, he started working on what you see over there, this aortic support, that a couple of months later, he asked his doctor to put around his aorta, because of course, he could not do that at home. I mean, making a more complex story short, Tailgoldsworthy, the patient, developed the solution that you see over there that has been implanted on over 100 patients. It's now a product that patients can get, and of course, is saving many lives. So, you know, in our research, we bump into Tailgoldsworthy and then bump into Amit Goffer from Israel. We just saw in the previous session an exoskeleton. Guess what? The most sophisticated exoskeleton that is out there in the market was not developed, and sorry to say this, by any robotics company. It was developed by a patient. It may be hard to believe, but it was actually developed by Amit Goffer after he got paralyzed in a car accident. So, you know, we were finding all sorts of interesting examples, different types of diseases, like Michael Sears. Michael Sears is a Crohn's disease patient. One of his problems is that he had 21 surgeries. He also had cancer, by the way. Part of his intestines were removed, and he was ileostomized, which means they open a hole in his around here so that the contents of the intestines now flow to a bag. It's not very nice to use one of those bags, but 5 million people around the globe use bags like that. One of the problems that they have is that they don't sense how full the bag is. So it's often very embarrassing. Michael developed what you see over there, a sensor that now communicates via Bluetooth with an iPhone and tells you how full the bag is. And I could go on with many examples, like Lisa Christ. Again, after surgery, she had a mastectomy, both breasts were removed, and she couldn't take a shower. Her doctor told her not to take care of her personal hygiene with a shower. And, you know, in fact, to try to fix that problem, she developed the shower chair that you see over there that allows this woman to actually take showers. Again, what's the common story here? Well, it's the fact that all these innovations were developed by patients. At some point, we studied cystic fibrosis in detail. And we found around cystic fibrosis lots of interesting solutions that actually work, like the frequencer, the machine that you see over here. Well, this machine was developed again by a patient. The frequencer was developed by Louis Plante from Canada. It uses music vibration to actually clear the lungs, because one of the problems is that these patients need to clear the lungs so that they don't get lung infections. So, you know, again, making a long story short, he developed the machine that most patients now use. And when we then studied this disease in detail, we found many other patients from, you know, a surfer in Australia to some parents in New Zealand or David Day from England. Again, I mean, David Day needed to take care of his daughter. And what he developed is the computer game that you sort of see over here. But it's not just the computer game. It's the device that the girl, his daughter, has in her mouth. Because now what this system does is that she can control the computer using this system and not the keyboard. I mean, I could go on with lots of examples now from caregivers, because now I'm talking about a different type of user. It's now the father that takes care of the daughter, right? Like you see here, what we see here is, solutions, say in this case for cancer, when this girl, Keely, had to do chemotherapy, she would need to spend a lot of time attached to these support systems here. Her father sort of decided to make that more bearable, and what he did was to adapt this backpack so that she could now walk around while she does the treatment. Or Debbie from Israel, her son has cerebral palsy, and one of the problems that these kids have is that when they are supposed to stand up and walk, they simply cannot do that. So she developed the EPSI, also now a commercial product, that allows these kids to start walking because, the system allows to attach the kid to the adult so that the first steps are given with the help of the adult, right? Or sometimes very simple solutions. This solution was very important for our project because it's very simple. And it is related with a disease that is called Angelman syndrome. Again, one of the problems that this mother had is that, her son was already 8 years old and he could not stand up and walk. So one of the problems that she had was that nothing seemed to convince Gonçalo to stand up and walk. Until one day when she went to a birthday party and there were lots of helium balloons floating around, and basically she was really intrigued because when her son saw the helium balloons, he started jumping to get the balloons. And this kid could never really get excited with anything. And suddenly, some balloons were able to help him. I mean, as you can imagine, the next thing she did was to go and buy balloons. And shortly after, with the help of helium balloons that were floating around her house, her son could start walking. I mean, as we were giving talks like these ones, we were sometimes intrigued with the fact that people would tell us, thanks for sharing, because, I tried this solution with someone I know, and it works. So there was what we call a diffusion problem, right? Because it shouldn't be necessary to listen to this to know about the solutions. And that's when we decided to put together the platform I told you about, that has been growing in about 3 years to around 700 solutions that were medically approved by our medical team, and we have our chief medical officer in the panel as well. So, these solutions are coming from everywhere. They are validated by our medical team, and there are a few medical doctors. This is our team in Lisbon. This is actually our advisory board that includes 2 Nobel laureates. And the project is going super well because we have received support from patient associations literally everywhere, from Australia to Brazil. Other interesting supports such as the United Nations or the University of Harvard Medical and Business Schools, when we actually participated in a competition in which we've got more votes from the crowd than any of the 475 projects that participated, or when the European Commission called us the largest deal flow of medtech in Europe. And, lots of nice things have happened to us. I will not bother with all the details, but one of the nice things that is happening now, because for us, a non-profit project that basically needs to be known by patients so that they can benefit from these solutions, is the fact that the Science Museum in London is doing this exhibition about our innovations. And this exhibition is now traveling across 29 countries. It's going to be seen by millions of people, which is super important for someone that needs to spread the word. And, sometimes we are surprised. And let me just guess, how am I doing on time? Because I'm a bit confused by these 13 minutes.
No, it's okay. It's this and
am I okay?
Yes.
Because I know I don't have 13 minutes. But, Ivan Owen, let me tell you about some of the intriguing things that have happened to us. I mean, Ivan is a puppeteer from Seattle. What he does are puppets for theater, like ants, as you see over there. At some point, he did the ant that you see in the upper side corner, and he put a file online with this ant that actually moves. He did a YouTube file and posted it online. To his surprise, he immediately got an email from a guy in South Africa saying, Richard Van As, also in the picture, saying, look, I'm a carpenter. I used to have 5 fingers, and now the machine chopped 3 of them. I'm left with 2. I don't have money for a real prosthetic. I saw what you just posted, and guess what? I'd like to get one of those because it seems cheap, I could afford that, and would bring me back some of the functions, right? I mean, he asked for help from Ivan, and Ivan helped him. The next thing we know is that Ivan got to know our platform, and he started interacting online with people, and that's when Nuno's mother, that is from Lisbon, my hometown, basically knocks at my door and says, I need your help because I know you have a 3D printer and I have the code to 3D print an arm and a hand for my son. Of course, we didn't know how to do that in the beginning, but she got the code via the platform so that we could actually do it. And, during one weekend, and with a budget of no more than 18 euros, we produced what you see over here, which is an arm and an hand. Let me tell you that Ivan created a movement to print hands and arms like these ones. In fact, the design for the hand alone is much better than when you have to print the arm and the hand. And he estimates that he has produced over 1,200 hands. It's basically no cost, because when we are talking about $18, we are talking about something that is so affordable that we don't even think about the cost, as opposed to a real prosthetic that costs something like $15,000 or $10,000, right? And we did that, and this sort of shows how innovation today is really distributed and collaborative. These are some examples of the team some pictures of the team when we did that during the course of the week. Having said this, many of these solutions are now being freely shared in the platform. But we know that we need to do more. We need to, try to bring some of these solutions to the market. Some are so simple that if I show you the slides with the balloons, you can do it at home immediately. Others are so complex that, of course, we cannot produce exoskeletons at home. So we need to help these patients to become entrepreneurs. Some want to do that, or, in one way or another, to bring these solutions to the market. And that's what we are trying to do now, which is to create this so-called patient innovation accelerator that will help these patients to see their innovations materialize in products or services. And that's why we are so happy to be here in Stavanger today with the University of Stavanger and other partners to see to what extent we can actually do this here as well as we are doing it in other parts of the globe. So that's what I wanted to tell you. Thank you so much.
Thank you. Now I'll try to take over. I'm a professor of entrepreneurship in the University of Stavanger. And as my role is to, do research and educate students about innovations, when we come in touch with Pedro and Helena, we were so fascinated because that's the source of innovation you rarely think about, right? I mean, you normally teach students about the innovation processes in the firm and the professionals who develop innovations, but here we have amazing source of innovations, and that's our patients, right? So I also would like to say that we come in touch with Pedro and Helena due to the research project funded by Norwegian Research Council, which I'm a project leader of, and which looks to the digitalization in e-health or in the health sector and welfare sector, and where Norwegian Smart Care Cluster is our partner. And doing these innovations in the e-health sector in a responsible way, I think that patient innovation is one of these examples. So that's why I personally thought, what can I do, to support this fantastic initiative? And this is a non-profit organization, so the best we can do is actually to spread a good word about it and to establish a local chamber of patient innovation in Norway. Because as far as I know, you have local chambers in Germany and in other countries, but not in Scandinavia. And here, we see a lot of benefits, and of course this platform will be very useful to patients who suffer from the chronic diseases, but it also will enable to transform patients from the object of treatment to active innovators and even entrepreneurs, so we can help them to develop a new role and make them entrepreneurs. I think it is a fantastic opportunity. And on the other side, I'm thinking we are facing the situation where the cost of treatments is going up, and we have more and more people who are in need, especially because of this aging wave that we are going to meet in the future. How we are going to help our government to actually fight this, and that is by activating us, users, patients, to participate in the innovation process, right? And that's why we think it is so important. And we have already done some research with their master students performing her master thesis on establishing local chapter of patient innovation in Norway. And what she found actually that 18% of Norwegian population between 16 and 66 years old suffers from some kind of disabilities. And if you think that each of these persons have some family members and some caregivers around them, then we can approximate this to 2 million people who can be impacted by patient innovation. And in Norway, there are 5 million people. I mean, this is 1/3 of the population of the country can actually benefit if we spread the good word and promote the patient innovation in this country. That's why I think this is so important to do this. And also, as an educator and researcher, I think it's also important to educate new generation about this phenomena, that patients can be also innovators and entrepreneurs. And I invite my colleague Elisabeth to talk a little bit about our thoughts, how we in the University of Stavanger can actually educate future generations on this. Thank you. Yes, yeah, you have to press the next one.
Yeah. I'm Elisabeth Willumsen. I'm situated at the Faculty of Health, and I'm very happy to be invited into this project. One part is to promote the project, the portal, and in healthcare we are very concerned about service user participation, and I think this is a very excellent example of how we can involve patients. But we are also part of higher education, and we have quite a few students. We have students in healthcare, we have students in business and engineers, and they will all be part of our future, what should we say, workforce that are going to develop this further and also implement in healthcare. So we have decided to try to pilot an interdisciplinary learning module and combine students in an interdisciplinary way to start looking at and take the basis in the platform cases, because there will be technological solutions, there will be different kinds of diseases, situations, incidents that people experience in their daily practice. And we could use those cases to develop students' involvement, because then they can work on problem-based learning or maybe simulation or other pedagogical methods. And we hope to decrease stereotypes and other barriers. And we also hope that shared learning during education makes collaborative work easier in the future. And this is what research says already. And the students will be trained to use the patient innovation platform actively and make it accessible and operative in communication between patients, service users, health professionals, and entrepreneurs, innovations managers, and other stakeholders. And we think it's a great potential to use the platform, although now at the moment it's all in English, but University of Stavanger is about to decide to see if the university will take a central role in implementing the portal in Norway, and then we will develop our own cases. Yeah. And the next one is Arild.
Thank you. I work in a Norwegian smart care cluster, and we work with innovation and creating the market. And we think this is a very unique project in that it is a real patient innovation, real user-driven innovation, and that is something we see that everyone can benefit from learning, that the real need creates a real thing. So in the regional aspect of this, it fits very well in what we try to do, both with the university, with the cluster, with the hospital, with all the actors will come together very nicely, I think, around this project. And we hope to get the Norwegian chapter up and running very soon, and start promoting it so we can get the first cases in. And we also see it as a source of ideas to put in an incubator. I also work in the Validé, the incubator in the region, so that we see that this also may be a source of new ideas that we can help develop into companies or to products. So with that, this was a small flavor of patient innovation, user-driven innovation, and we are very excited about this. I'm very pleased that the university will take a lead on this. It's a non-profit, and we think it's a brilliant arena for students, both to learn on innovation, but also in the health side of the students. And this will come together with ICT, with mechanics, with electronics, in a very good manner. And then, of course, can you also weave it into this, to the teaching? It will be a win-win for all. So look forward to that, and thanks for listening.
Yes. Thank you. I think we have the last slide, which is just thank you for attention. Yes, and we are open for questions and feedbacks. Thank you. Yes.
What are you doing about the regulatory issue? Because you showed different things, and some of them don't require. On the other hand, if you look at the Amit Goffer's product, it's $60,000, a tremendous amount of regulation. The company is almost bankrupt. So it really, the varieties of your examples there is so broad that it's very hard to get your message out of it. I know you're saying, well, the individuals, they can develop. That's obvious. But if you think about not developing onesies and twosies for an individual patient, then it becomes like all other companies with all their problems.
Yeah, thank you so much. I'm glad you considered it obvious. I mean, for a long time, it wasn't obvious that patients were innovators. So that's why we basically have no similar project on around the globe. But as you said, and you said it well, I mean, we have a very heterogeneous set of situations here, right? Some require a lot of validations, others are simpler, like the balloons. So, basically, the ones that we also have a very heterogeneous set of situations when it comes to commercialization. Some are already available in the market, others are not. So that means that as of now, I mean, what happened was different for the different types of products. In some cases, they went through the validation, intellectual property protection, market research. They did already, or in some cases we helped, everything that was required for this product to be now available in the market, and for instance, for the aortic support to have been implemented in over 100 patients in London or in England. Most of the operations were actually done in London. So it's a very different set of situations. What we are doing in terms of this accelerator is to provide the services that entrepreneurs need to bring an healthcare product to market. And that's different for different cases.
But may I add something? because we have terms and services, and when someone try to share the solutions, it's on hold until being reviewed by the medical team. And we don't accept drugs nor invasive products. They are only accepted after being approved by the regulatory institutions like the aortic support. So things that are invasive or drugs are not allowed. It's only after approval. Some strategies or some products that are not considered as healthcare devices can be posted online after the screening by the medical team.
So, first of all, I think it's a nice idea, so I'm not trying to put it down. That should be very obvious, it's nice. But it's more like an impact program. I mean, like, there's no difference between, in my mind, as a person that is involved in developing these products for 40 years by now, okay? Mm-hmm. It doesn't make a difference to me who developed it. A physician sees what the patient...
No, but you are wrong.
Wait.
Okay. I can argue with you because I'm a medical doctor and I can argue.
No, you can argue, but the argument doesn't make any difference. Somebody needs to put money into developing some of these things. Some of them are not expensive, as you gave examples, and like in Israel with many of them. Wait a second.
It's not only the money, it's also the needs, because lots
So I said to you, it's an impact program.
Why? Impact program.
Program. And impact, you know what the term impact is today?
Of course I know, but what I don't agree is that patients have needs, and sometimes the producers don't know the needs of the patients. And when we did a study about these type of innovations, only 5% of the patients shared with the doctor this type of solutions. So these solutions must be diffused, must be shared, because no one knows these solutions. So this is really important to share these, because otherwise they are only at home of the patients, and nobody knows about it.
As I said, I have no interest in arguing with you, and I will not argue. I'm just saying to you that in order to have it diffused in the marketplace, you need to do, not on every product, but on many of them, you need to do the exact same thing that you would do with any product out there. And some of them are unique and nice and whatever, and therefore the program is a super program, no question about it.
Yeah, but I mean, what you are saying is obvious, so what's the question?
There's no question. I was saying to you that, in my opinion, it has the format and the thought processes of an impact program. And as such, it has a very important role. And I only wanted to suggest to you that if you wanted to achieve financing to make this program available or copied or whatever in many places, the big funders of something like this are the impact funds or organization. That was the only thing I was trying to say.
Yes, and I think that is very relevant. We recognize this. In Norway, it's called social entrepreneurship type of programs that it will go in. So yes, definitely.
Okay, a big thanks to the panel, and we appreciate you taking all the time and travel to come here.
One more. Yeah.
I have two more questions. Is it time?
Yeah, I just want to say a big thank you for taking the time and travel to come here, and it's a long way, so appreciate that. Thank you.
So my name is Tristan from the University of Stavanger, so I'm one of your colleagues. I'm just interested to know, how do you actually govern the interactions or the partnerships among the various stakeholders within this project? So particularly I'm very much interested into the Norwegian context.
Is it a question for Stavanger team or Portugal? Yeah, we are of course learning from our colleagues in Portugal how they do this, but I think in each country you have to find local stakeholders who are really engaged. And in our case, I think we started with the Norwegian Smart Care Cluster in university, and I know that some people in the University of Stavanger would be interested to support this. And we also talked with non-profit organizations and also patient organization in Oslo. Our master students have done research on that, and she introduced and there were, it was overwhelming, like positive. People wanted to support. They interested how they could actually contribute, and how we can make it happen here. So I think it's very important that we have these partnerships, and we cannot change the world alone. That's impossible. So we need good partners for that.
Okay, I had overlooked one question.
Thank you for your presentation. That was great. I was just puzzled by and have a question when it comes to the collaboration, the potential collaboration between the students and the patients. At what time in the innovative process before maybe becoming a solution is there a potential for collaboration between education and students and patients? Is it only like the cases and the solutions that the students can work upon, or is it also at the level of ideas that is trying to be innovated?
Should I? Is it okay? I answer. It's a good question, and at the moment we are exchanging ideas, but we have some ideas that your students, Tatiana, they could come with the nursing students and go into nursing homes. And because like our nursing students, they will be in all nursing homes in the whole region. Yeah. So it's very easy to exchange experiences if we have like interdisciplinary practice. So we'd like to invite students from engineering and innovation management into the practical field. And we also got an invitation from SUS, our regional hospital. And they wanted us to come down and see at the surgery department. So I think still as ideas, but there will be a lot of potential to exchange experiences where students can get involved, also with patients.
Maybe Helena can also add from your experiences.
Yes, we have some, the part of the technical part can be a potential collaboration between the engineering students, because we have some solutions that students participate in the development, and also some master theses from the management side and innovation side, studying the process and the entrepreneurship there, and also the innovation. So there are different types of collaborations that are possible between the students and the patients or caregivers.
Thank you. I am afraid we have to